Hey everyone, it's Shan Crawford. I am a life transformation coach, and today we're going to talk about why therapy works for some people and why it doesn't work for others. How you can get it to work for you if this is something that you want to get into, and how you can help yourself if therapy isn't the right choice for you. Now, I am not going to tell you that, oh, you need to go over and get a life coach and I'm plugging myself in for services here. No. I'm talking to you about this because I'm all about transforming yourself, evolving yourself, helping you to improve yourself. And it does not have to be through the means of me. But I know that a lot of people get stuck in the rut of going to therapy for years and years, or they try it once and they stop because they feel like it's not helpful. And then they're stuck 5, 10, 20, 40 years later dealing with the same issues and never being able to get what they want out of life or get better, feel better, enjoy life, have the kind of life that they want to have, because whatever it is that they thought they needed therapy for has never been dealt with and they don't know how else to deal with it. So that's why we're going to talk about this today. Okay? So, one of the things that is important when you consider therapy is who you're actually having therapy with. This is something that I learned in my experience working in mental health for almost a decade. I know I look young, however, I've worked in mental health in so many different ways over the last 10 years, and I'm not even going to name all of the different ways. But not only did I work in mental health, I also work with the branches of mental health. So drug addiction, substance abuse, drug treatment, substance treatment, alcoholism, family advocacy. So, that's like domestic violence and all that kind of stuff. And social work, behavioral health. I've worked inpatient and outpatient mental health. And then I have a psychology degree, social work degree. I also have a management degree. So I really understand how people work. And this is how I have come over the years to discover that this is what people need to hear. Okay. So one of the things that I would tell my patients back in the day and some of my clients today, or even prospective clients and people like you who are looking to help themselves in whatever way that is for them, is that the kind of therapist that you have is important to your development. So you want to be looking for, if you connect with the therapist, it's important. And I know that no one brings that up. No one thinks, sometimes people don't think about it. I won't say no one thinks about that. But if you go into a therapist's office and you feel like, I really don't feel like they're getting what I'm saying, or I really feel like the kind of what they're suggesting to me does not make sense, no matter how many different times they explain it to me, it's not clicking for me. And that's probably because the way that therapist's brain works and the way that they explain things, regardless of training, this is beyond skill. Now, some very good and very experienced therapists develop over time the ability to explain what's going on in their brain and transfer it to you to understand based on who you are. But not all therapists have that ability or that skill set. Honestly, it's kind of a talent. So you want to look for someone that you connect with, that you feel like you can relate to, maybe not even necessarily relate to, but someone who feels comfortable for you. For me personally, I look for a therapist who I feel like understands the way my brain works, because I'm an analytical type of person. And if I get a therapist who is very extroverted and they don't necessarily think a lot about a lot of the things that I think about, then some of the stuff that's going on in my brain, like I cannot explain that to them, and I cannot get them to understand why I'm having a problem getting past what's going on in my brain. So they may suggest to me, oh, just get out and go and socialize. And for me, I'm trying to explain to you that this socialization, it's not working for me because of X, Y, and Z. And they're just thinking, yeah, well, you're limiting yourself. The way that you're thinking about it is wrong, and I'm telling you the right way. Or they may just think you just need to adopt new methods, and once you just do what I tell you to do, what I suggest you to do, then things will get better. But someone who thinks the way that I am, who might be introverted, who might be analytical, would be able to understand what I mean when I say that it's a hiccup for me, or I have a hard time A, B, and C, so that they can explain to me why I might be having a hard time with that, or how I can really get over that as an introvert or an analytical person, or a deep thinking person, right? Another thing, you want to definitely feel safe with the person. Just the other day, I was there was someone who was in my DMs asking me about my business, and they were saying, do you want to increase your business? And it's like, everybody wants to increase their business. So I'm like, sure, yeah, I do. Of course. Who doesn't? And I feel like they were trying to pitch to me or get me to get on the phone with them so that they could sell to me whatever they're selling, so that I could get better business. But when I was telling them that I'm not really interested in it, I really felt like they were strong-arming me, trying to strong-arm me into getting on a phone call with them. And that doesn't sit well with me. So if I was to try and engage in business with her, right? Her methods, the strong arming method, her personality, the way that she sees things should work, may not resonate with the way I see things should work. So what she might tell me to do to help myself and to increase my business may not be helpful to me. And I might not feel very comfortable using what it is she has for me to offer, if that makes sense, or safe doing that, because I'm not that kind of person. So you want to have someone that makes you feel comfortable and safe in expressing yourself and being able to talk about things that are difficult to talk about, instead of strong-arming you or trying to force you to talk about something that you're not comfortable talking about, or try to force you to do things that you're really uncomfortable with doing. Yes, therapy is a means to help you do things that are not comfortable. If they were comfortable, you probably wouldn't be there, and you could probably do it on your own. But if there's a strong feeling of that, or you notice that they're doing that all the time, then it's possible you might need to consider someone else. Okay? Also, I think all of these that I wrote down are kind of explained in that sometimes therapists will diagnose you incorrectly, and going off of those diagnoses, they could be treating you completely wrong. So all these years you could be taking this medicine for something that you do not have. And it can be hard to advocate for yourself when you're not the professional. You don't know exactly what should be working or how things should be working, or what they're saying is normal. So for instance, let's just say that they diagnosed you with depression and you really honestly have anxiety. It's not depression. So they give you depression medicine and it's not helping with your anxiety, but they keep just telling you that you have depression, but you're like, I'm not feeling depressed. I'm just feeling anxious. Like I just get nervous around these certain things. And they're just like, take the medicine. It'll feel better once you take that for a while. And then 2 years pass and you're still taking this medicine and they're still telling you that it's going to get better after you take the medicine for a while. And you don't know any better because who educates you about these kinds of things? And like I said, you're not the professional. So how are you supposed to know what they're telling you is not right? So, for one, it can be helpful to seek a second opinion if it's possible. You could see another therapist without asking them to release your records from the past therapist, because sometimes they will just give the records to the new person you're seeing, and the new person will just go off what the old therapist said. Now, some will actually are good at their job and they will actually get to the bottom of it or try to correctly diagnose you, but not always. So try to do so with a clean slate, as if you weren't seeing another therapist without the information from the other therapist, or try to have someone that you trust that has your best interest in mind to help you kind of decide, like, is this helping you, or maybe you should try another therapist. Okay. Oh, and this one is a really good one. So I used to work in an outpatient mental health clinic, but they had 4 different clinics within the mental health. So drug abuse, family advocacy, drug demand reduction, and mental health. So that means that the providers all had different types of credentials. So one might have been a social worker, one might have been a psychiatrist, one might have been a therapist, one might have been a psychologist, one might have been a counselor. And some people would come in and see a certain therapist, and that therapist was extremely, I don't want to say soft, but there's an element to her methods that were kind of enabling. So her clients would often come to the clinic in the middle of the week, in the middle of the day, asking, "Oh, can I see the doctor? I just can't get through the day." Or they will come back more frequently than suggested. So maybe the therapist says to see them to continue appointments twice a month, every 2 weeks, and this person is coming every week because they feel like, oh, I can't make it to the next week. And that's because this therapist does make them feel very comfortable and very heard in session. But to make the moves in order to kind of wean them off of therapy, because the goal is to get them to use what tools they learn in therapy and not need therapy anymore. But this kind of therapist can be enabling, but it can make a lot of people feel very safe, especially if your personality or the kinds of things that you're dealing with require you to want to feel safe. So make sure that you, if possible, are not continuing to see a therapist that is enabling you to not do the work and is not pushing you enough to wean yourself off of therapy. If you've been going to your therapist for 7 years and you feel like you've kind of been dealing with the same issue for 7 years, it might be time for you to visit another therapist or to try someone else to see if they have a different way of doing things that might help you wean off of therapy. It's completely okay to take your time to work through therapy, and it's okay for you to work through an issue, not need therapy, and then come back to therapy if you need it again in a few years or a year from the last appointment. It's fine. But if you're not being pushed outside of your comfort zones and pushed to work on the issues that you're in therapy to discuss, you should consider another therapist. Okay? Some of the things that you need to address in your life are going to be uncomfortable to admit in therapy regardless. So no matter how healthy you get or how much you've progressed or healed in therapy, some issues are just a lot deeper than others. So I would never encourage you to just keep hopping from therapist to therapist if they're not helping you to fix the issue right away. So definitely try to work through it. But I'm just saying, if it's been several years or you've been with the same therapist for a long time and it's the same issues, then you should consider working with someone else. Now, when I say that therapy works for some people and it doesn't, considering all the things that I was just listing, some people, because of those issues I mentioned, not getting along with their therapist or not feeling comfortable with their therapist, being enabled by their therapist, it makes them feel like it's a waste of time, it's a waste of energy, it's a waste of effort, and it's a waste of money. So they will stop going to therapy, or they'll keep going to therapy, but just having this hope that miraculously someday they'll get better as long as they keep going to therapy, even though it's been years and years and they've been doing the same thing for years and years with little to no progress, right? And then there are some people who go to therapy and they understand, okay, this might not be a good fit for me. Maybe I should try someone else. They go to someone else and now it's working for them, rather than, sticking with someone who they don't really feel like gets them or feel comfortable with. And then also, like I said, with the medication thing or the wrong diagnosis, if you're diagnosed for the wrong thing and you're in therapy to address that issue, but that's not really the issue, then that's why it's not working for you. But one thing that's even more important to consider is that sometimes people ask the difference between why would someone go to therapy over a life coach or a counselor or just a mentor if they're trying to solve a certain issue in their life. And there are a lot of people that use life coaches for things like trauma, because the trauma in their life is stopping them from getting to certain goals. So the difference between a therapist and a life coach is that a therapist is usually going to help you figure out for yourself what you can do to help yourself. And a life coach is more solution driven. And the difference between the two is that a life coach more or less will be straightforward with you about steps that you're going to take in order to achieve a certain goal. And a therapist, there may not be a tangible goal in sight, or the goal may just be for you to feel better, but you might not have necessarily something that you're achieving or being prevented from doing. Yes, I just want to make sure because my words are all over the place right now, but that's the difference between the two. One is more problem solving, solution focused, and the other is more process focused, right? So if you're the type of person that does not really need an entire process in order for you to get something done, you just need to know how to get it done, or you just need to be told what to do to get it done, you might benefit from a life coach more so than a therapist. And I say even beyond that, without even the help of a life coach, if you're the type of person that just needs to be told what the keys are to get whatever it is that you're trying to get done, you don't need a life coach. You can do it. You really can do it yourself. You might really just need a mentor, someone who has done what you're trying to do, and invest in having them teach you to do that, rather than going through the process of, what is blocking you, what trauma you need to process, because sometimes that doesn't always need to be addressed for what it is that you're trying to do, if that makes sense. Makes sense. I would never encourage anyone to just push down trauma or to not deal with trauma. I say this with caution, but also to help you, because some people will go to therapy and they're really not interested in processing trauma for real, but the therapist is interested in getting to the trauma, and there's a conflict of interest there. So the client feels like they're not getting what they need out of the therapist. I just need solutions. Just tell me what it is I need to do to get to where I need to go. And if the therapist is not trying to hear that, they're like, it's not about what you need to do, it's about what you need to feel, what you need to process. That might not be the solution for you. And sometimes getting over trauma is achieving. Sometimes getting over trauma is not necessarily processing through all of your emotions and everything, every memory and everything that happened. Sometimes getting over trauma is getting confidence back in yourself. And sometimes that comes from doing what needs to be done, or getting to what you feel like you're unable to get to on your own. So that's the difference between needing a therapist, if therapy is right for you, needing a life coach, if life coaching is right for you, needing a mentor, if mentoring is right for you, or if honestly you really can tackle your issues on your own, and you just need the help of someone for a short amount of time. There's a difference. So I just wanted to talk about that today, because there's a lot of people who don't know the difference between the two. There's a lot of people who are coming to life coaches and they really honestly need therapy. And there's a lot of people going to therapy who don't really need it. And they're like, they don't understand why it is that they're not able to progress, to move forward, or to get their problem solved, when the way that they're going about solving it is just not the solution. So that's all I have for you guys today. I just wanted to share that with you. And of course, if you would like to press the like button to help me to grow my channel, I would appreciate that. And I would hope that you could subscribe so you could see me in future videos if you felt like this was helpful to you. I think that you would love to hear from what I've got in store for us in the future. So until next time.